The Susan Brender Show is a radio show online broadcasted on YouTube across the United States and globally. The show features guests who speak about health, spirituality, entertainment, and a host of subjects to enlighten people across the nation. Listen to the show that empowers women and men alike and highlights those who have made a difference. I'm Susan Brender, and this is the Susan Brender Show. You know, everyone has experienced an injury or who has been in pain at some point in their life. It can be all-consuming, create panic, anxiety, nervousness, anger, depression. You know, there's a wide range of emotions a person can experience when they are in pain. And my guest today, Scott Miller, can explain what you do and how gratifying it is to know how to be able to alleviate a person's pain and get a person back to whatever it is that they want to get back to, whether it's something as simple as sitting at a workbench without excruciating pain or running a marathon. And I want to welcome to my show Scott Miller, who's been a guest of the show many times, and he always offers a lot of information and education about how to keep your body in good shape. So with that said, welcome, Scott.
Well, thank you very much, Susan, for having me on the show again. I always enjoy being a guest of your show and giving everyone some good information. So,
yes,
thank you
you
very
do.
much.
And you know something, I probably asked you this question before, but I really want to ask you again because a lot of opportunities are out there for people. I mean, they can do virtually anything they want, especially if they've got a good mind. But you chose to be a physical therapist, and I want our audience to understand why.
Well, that's actually a very, very good question, and a lot of physical therapists who are in this field are usually in it for very very similar reasons or circumstances. One where we as physical therapists, across our occupation, we do love help. We love helping people. So that's certainly one of the aspects that why we get into this. I do get gratification for rehabbing someone's injury, helping with someone who's in pain, and the other reason, and a lot of physical therapists get involved with this career path is because they've been through it themselves. And I had a big knee injury when I was in college that required me to have surgery and subsequent 5 or 6 months of physical therapy, and that really kind of catapulted me into the field of physical therapy and really narrowed my focus to get into physical therapy school.
How do you measure success when working with a patient?
Success, you can measure it a couple different ways. One is subjectively, and that's basically on how the patient has been feeling. Their a pain scale. How they've been able to tolerate their daily activities. Are they able to do movements and activities that they weren't able to do before they came to see you? So those are subjective ways that you can measure their improvements. And then there's objective measurements, and objective measurements are specific measurements to their range of motion, to their strength, and specific numbers that can correlate to a patient's improvements.
Yeah. Have you ever encountered a patient who was determined to improve their mobility within an unreasonable time frame? Some people come into virtually any kind of doctor and they want results immediately. But I'm sure that you've encountered an unreasonable amount of time that people think that they can be healed. And if so, did you communicate this to them when they seem to be so discouraged about their situation?
Absolutely. We see that all the time, because, especially with patients who may have not experienced injuries or issues in the past, and this is something really brand new to them, and they are very active individuals, and they want to, immediately know when they can get right back to playing a sport or going on their walk or going, swimming again. And, a lot of times they, have unrealistic goals, and sometimes they have, they're very conservative and they think they're never going to get back. So on both spectrums, we have to kind of play that psychology role and talk to them about, the realistic goals that are published out there that are, based on our experience, based on their specific injury and what they should expect. And if we, explain all this and communicate this with patients, I think they start the treatments off in a better state of mind, knowing where they're going to be, and about kind of what to expect. Obviously, things change with different injuries and different patients, and we try to kind of reassess and kind of reform their goals if things aren't going as planned, or they're going, quicker than planned.
Yeah. This is a follow-up to the question that I just asked you, and the question becomes, how do you find a balance between encouraging your patient to continue an exercise while also making sure that they don't injure themselves further? A lot of people come in, I'm sure, and I will tell my audience that you're my physical therapist, and I have an injury. My feeling about it is that it will take time, and I'm satisfied with that answer. But a lot of other people come in, and they say, I've been playing a sport, whether it's tennis, whether it is baseball, whether it is swimming, you name it, and I want to do it. I need the exercise, especially now during the pandemic, where people have been sitting around and just doing virtually nothing. And today, they're able to go out and to do it. And so if they come into you and they say to you, kind of get rid of this as quick as you can because I've got to do it, what do you do to encourage them?
Well, we try to tell them that, we're going to develop a good plan for them to get back to any activity that they would like to, and there's no activity that I will ever say that we absolutely can't do, because we won't know until we actually can't, absolutely can't do it. So we try to, I try to tell patients that, we're not, trying to get them to do their activity by tomorrow, but we have to take baby steps to get them ready for whatever activity they're going to do. It's the same with any type of athlete. I give them examples of a professional baseball player comes off a shoulder injury, and this is an elite athlete who's a professional athlete. There's no way that if he injures his shoulder and he's feeling a little bit better, he's going to get on the mound and pitch a game. There's an entire protocol and step-by-step instructions that need to be taken so that he's ready to get back on the mound and pitch like he was able to pitch before. And that goes for even a simple exercise like walking. You have to be able to, before you do a fast-paced walk, you have to be able to walk a short distance and a slow-paced walk. If you're able to do that, you can start increasing your level of activity and increasing what you're able to do.
Yeah. How do you stay up to date on the latest trends and technologies in physical therapy? You're so busy, Scott. You have so many patients, and a lot of them take a lot of time. But, it's very important from my standpoint to be able to, really do the latest trends in physical therapy. And so my question to you again is, how do you stay up to the trends, the new trends, if you will?
The new trends are all, continuing education is a great avenue for learning new techniques and new trends. Doing a lot of reading articles, and taking continuing education classes to stay up with any new technology, any new things that are out in the field of physical therapy.
Mm-hmm. So let's assume, okay, I'm going to give you a specific case. A patient comes to you with a mild ACL tear. What exercises and treatment do you start them on? Because, that is a very common thing. Am I correct about that, ACL tears?
Yes, absolutely. ACL tears are very very prevalent in the active population, and it depends what exactly is going on. If it's a mild strain of it, or if it's a complete rupture, treatment is going to be a protocol is going to be set, and we have to take an evaluation and see what they're able to do, what they're not able to do, what issues they have, and then you have to develop a plan based on that. So every single patient is completely different, and and you have to take and set up a plan based on that specific patient and based on their specific limitations and goals.
Yeah. You must have had a challenge with one of your patients, a real challenge. And I'm interested, and I think our audience would be interested in how you dealt with that, because sometimes people come in and, we talked about this a little bit. They have expectations of getting better fast, or they're scared. I mean, I know, and I've spoken to some of the people, and they say to me, I'm in such pain. I have so many problems, and I don't know where to go from now. And they go to you, and I'm interested in knowing, and our audience would be too, to know how one of the challenges that you've had in the past and what you've done about it.
Challenge with a specific injury or challenge with a specific patient. It really depends on on the exact the patient that we see, and of course there's always challenges that arise, and plans and protocols that are not always going as as planned or as the patient wants or as we would like, and sometimes we have to change up what we're doing with the patient. Sometimes we have to go ahead.
Yeah, no, I was going to say, I'll give you an example. I mean, I've seen people come to you who've had strokes. Now, strokes are pretty devastating, and it causes a lot of problems to the body, okay? And, do you take care of people like that? What's the level of the type of patient that you deal with?
We certainly do primarily orthopedics in my practice, but I have worked in the hospital settings and nursing homes that deal more with neurological, in more of a neurological setting, and work with stroke patients and spinal cord patients. And, there's certainly, therapists that work in those settings with, the neurological patients certainly faces completely different challenges than we certainly face here in an orthopedic based practice. With neurological issues, you're dealing with a much slower progress. You're dealing with nerves trying to regenerate and trying to get muscles that are just not functioning properly. So that's a very challenging area of practice to work in. And I do have a little experience, but my main expertise in practice for 15 years now has been orthopedics. Orthopedics.
Now, when in your opinion, and this is a simple question, but I think it's important. So, in your opinion, what are the best stretching methods to treat chronic arthritis? Now, I'm asking you about arthritis because a lot of people, as they grow older, do experience arthritis, and arthritis can be very painful. So what is your approach to dealing with that?
Well, arthritis is certainly a very, very challenging diagnosis, and every single patient presents completely different with an arthritic joint. And let's take the knee, for example. I have some patients that come in and they're in absolutely severe pain in their knee, and their X-rays don't show severe arthritis. So, we will take the same approach with someone who is the opposite, who doesn't have a lot of pain, but has severe arthritis. We have to assess that patient specifically, what their limitations are. We have to see if they have limitations in range of motion and what muscles we need to improve and what muscles we need to strengthen. And a lot of pain with arthritis is not always a direct result from the arthritis. A lot of it comes from the secondary results, the secondary issues that are associated with arthritis, like muscle tightness, muscle weakness, change of mechanics of the knee joint and mechanics of walking. So with physical therapy, we have to fix all of those secondary issues because we cannot turn the arthritic knee, we can't change the arthritis in the knee. If it becomes to a point where the physical therapy is not effective anymore and they're in absolutely severe pain, we usually, sometimes consult with their orthopedist and see if they are a candidate or ready for a replacement of that joint.
Yeah, and I'm going to turn the question around for a minute. What is it about certain patients that make them heal much faster than other patients? Is it an attitude? Is it the state of mind that they're in? What do you think is the reason that certain people, just kind of walk out of your office and said, okay, I'm still in pain, but I know that I'm going to get better, okay? Why is that particular person? Go ahead. I think you get my question.
No, there are so many, reasons why patients, improve at different rates than other patients, and there's a lot of factors that go along with that. One major factor is, in fact, the overall psychology of the patient and the overall mental state of mind and well-being of the patient and how they perceive pain and what that does to their overall well-being. So I do see a correlation with patients with very good with good attitudes that are motivated to get better, that want to get better, as opposed to other patients who may have been told to come to therapy or don't care to improve, or they're lazy and they don't want to put the effort in to get better. And usually the work they put in it's going to show, whether for the good or the bad. And then there's a lot of physiological issues that can either help or hinder their recovery as well. If a patient does smoke cigarettes, that can certainly inhibit their recovery. If somebody is dehydrated and doesn't drink enough water, or their nutrition is off, that plays a big factor with their recovery. Sleeping plays a very big factor in recovery. So for patients out of surgery, if they're having trouble sleeping because of the pain, that can affect their mental well-being, which can affect their healing and their overall, rate of healing because of that.
Wow, that very interesting information that you're giving our audience, Scott. I always like to ask my guests for the last word. Is there anything else that we haven't covered which you think is very necessary for people to hear?
Absolutely, and especially during this time of the pandemic, I have seen quite a few patients that have come in because of their sedentary lifestyle during the pandemic. It doesn't matter what age or how old you are, but the more sedentary you are, the weaker your muscles are going to get. And as we age, that weakness certainly has a direct correlation to a patient's overall well-being and as well as their risk for falling and their balance. So I've seen quite a few patients that have gotten deconditioned because of their sedentary lifestyle during this pandemic. So, my advice is really to, wherever you're at, there are lots of things that can be done to stay active in the comfort of your own home. If you're in some nice weather and as the summer approaches, there's plenty to do outside. And, as you start getting back into, any type of movement activity or, activity, like we touched upon before, it has to be done slowly. If you haven't been doing any walking program for 9 months or a year now, don't go out and walk for 5 miles. You start off with just a few minutes, 5-10 minutes, a couple of, a half a mile, quarter mile, just to see how your body reacts to that. And take things slow and make sure you stay mobile and start getting stronger during, as you're becoming more active.
Wonderful. So how do people get in touch with you, Scott? I know have a physical therapy office in Delray Beach, Florida, but there must be a way that people can ask you questions. I see that you have a newsletter, which is really amazing and, gives people all the information and education they need. But the best way to get in touch with Scott Miller, what is that?
Yeah, well, I have a newsletter that you can sign up for on our website, which is www.miller, MILLER dash, which is the -, PT for physical therapy.com. That's www.miller-pt.com. You can email me directly from the Contact Us page, and you can also sign up for the newsletter and receive the newsletter once, every month that has some really good information. And we have a lot of really good content and information on our website with injuries and how physical therapy can help, and surgical and non-surgical, treatment for pretty much every injury out there.
Amazing stuff. And I want to say to the audience, you've been listening to Scott Miller, who's a physical therapist in Delray Beach, Florida, who really knows how to treat his patients. And he's got a staff that is really into helping people additionally. And so if you're in Florida and if you have an issue, this is the person to go to. Thank you very much, Scott, for being on the Susan Brender Show. It's been a pleasure.
All right, Susan, thank you so much for having me again. It's always certainly is a pleasure, and I look forward to the next show.
Yeah, absolutely. Thank you very much.